Okay, so hello, good morning. I am Demi Vaughn with the Power of the Patient Project. My guest today is Dr. Ryan Stahl. Dr. Stahl is a board certified orthopedic clinical specialist and doctor of physical therapy in Southern New Jersey for IV rehab. He specializes in the rehabilitation of orthopedic and sports related injuries and conditions. Ryan's personal philosophy involves improving patient health via manual therapy, exercise, and fitness, ultimately empowering patients with the tools they need to achieve their desired goals. Welcome, Ryan, to the interview.
Hi, Demi. Thanks for having me.
You're welcome. For my knowledge, I know that you have a very fascinating story to tell us. And I understand at the very beginning of quarantine, you led the rehab team at one of the pop-up pandemic hospitals that the state of New Jersey created in Atlantic City, treating only COVID-19 positive patients. You were literally on the front line at that time. So can you tell us a little bit more about that? Describe what you encountered when the pandemic had just begun.
Sure. I think before we begin, though, I think it's important to think about the timeline. So again, we're here in November. We're talking more when this was going on. This was more mid to late April. So in terms of timeline, our information was very different from what it is now, from what we know about the virus, how contagious it can be, how deadly it can be. So I just kind of want to start off with that as the forefront before we begin to discuss really everything that happened. So I have this vivid memory of driving down the Atlantic City Expressway down to Atlantic City towards the convention center, which is where the hospital was. And when I got there and I was driving up, it was guarded by the Army and Air National Guard. And I was thinking to myself, whoa, what is this? What's going on? Like, I really hadn't thought about them being down there at all. I knew that they had helped bring the hospital to operation, but I didn't know that they were going to be there. So I go in, and at the front door, there are guards there. There are military guards there, and I'm like, wow, this is a little bit insane already just walking in. So I walk in, I tell them who I am and that I need to get, credentialing and I need to get briefed and everything like that. So a lieutenant colonel takes me and escorts me into one of the convention center rooms. And sitting in there is chief of nursing, nursing supervisor, and a large group of physician assistants, nurse practitioners, and nurses. And we're all sitting there, and immediately we're just briefed about what we're going to be seeing in terms of patients. They're saying we're only going to take COVID-19 positives only, the criteria for the patient selection, basically everything that we knew about the virus to that point. So all this is happening like right away. And I'm just thinking to myself, whoa, this is a little crazy. Immediately after we're taken into the adjacent room, and it's a very large room inside the convention center. And that's where all the patients are, because I was there operational day 2, I believe, and there were patients there. So it got really intense as soon as we got into that next room, because we were in the same room, potentially very close to these patients who had COVID-19. And again, we didn't know a whole lot about the virus at the time. So it was a little bit crazy, and I think that's when it got really kind of surreal of the environment that I was walking into, especially when we had to practice and basically perfect how we were to don and doff PPE. Again, think of the timeline. End of April, there's a big PPE shortage. So we were a little bit worried and concerned, how much PPEs are going to be available to us? How are we going to be able to maintain safety so that we don't get infected, et cetera? So it was a little bit weird from that perspective. I remember, signing all the waivers and talking with, the colleagues there. But I have another distinct memory of driving home and just feeling an adrenaline dump because of how intense things were when I was there. Like, I just got so tired on the way home. I got home, I had to reset and understand really what I was about to go through, because, I remember telling myself at the beginning of the quarantine, like, if there's anything I can do as a healthcare practitioner, during a pandemic, I would want to try to do that. And then when I was faced with it, obviously I got a little afraid, personally, because we didn't really know a whole lot about the virus. So eventually, I talked over with my support group, and, I was, decided, okay, hey, I'm going to do this. We're going to get into it. And, that's what you want to do when you get into the medical profession. You want to help people. And, before we even go on, in regards to the Army and Air National Guardsmen and women that were there, I have to give a huge thank you to them because what I obviously, Veterans Day was just a couple weeks ago. So I obviously want to thank them for their service, but especially during this time because we didn't really know a whole lot about the virus. I learned that the Army Corps of Engineers and people of the Air National Guard, they were coming from other places of the country, some of which they had just returned from deployment and gone back home, and then in a brief turnaround came back over to our area. So I need to give a huge thank you to them for help keeping us safe and helping us get operational down there at the hospital.
Yeah, definitely. So, when this whole thing happened, were you notified like ahead of time, or was it just like kind of last minute? And how were you like chosen to lead this group of rehab therapists?
So in terms of preparation, there wasn't a whole lot of prep. I just applied for the position, got all my credentialing gone through, and then I think I found out on like Monday afternoon that we were going to be starting and be operational. And I believe I couldn't start on Tuesday for some reason, which was the first day of operation. So they got me in for Wednesday, and I started on Wednesday. So there wasn't a whole lot of time to prep. Again, we don't have a lot of information at the time about the virus. I mean, as much as there was being released to the public was pretty much all I knew. So in terms of a physical therapist perspective, we knew even less. We didn't know about the systemic effects that we now know it can have on the body and et cetera. So there wasn't a whole lot of time to prep. So when I got in terms of how you asked how I was to lead the team, I'll never forget another vivid memory when I was escorted into the room to be briefed. The chief of nursing and their supervisor were there, and they introduced me as the physical therapist. And I remember the chief of nursing looking at me going, "You're a PT?" And I said, yeah, I am. If there's anything, you need, like I'm your guy. And he said, "Oh, thank God, we desperately need you." And I kind of was like, whoa. It was pretty humbling, to say the least. You go to school for so many years because you want to help people and you learn all these skills. And then when you have, what is at that point disaster medicine, and you have somebody in that position look at you and say those words to you, it's pretty motivating. So if you want to know how I began to lead the rehab team, that was it. I said, "Hey, I'm your guy," and we went from there.
So, like during that time when you got there and you began to work with patients, what would you say were some of the challenges that you faced during that time? And after overcoming these challenges, how would you say that this helped you to become a better therapist?
Okay, the challenges that we faced. Okay, there were a lot of challenges that we faced initially. If you think about it from the hospital perspective, hospitals have been in operation for decades. So they have policies, they have procedures. This hospital was created in a very short period of time. So if you think about it, we had as much structure as you could possibly think of in about a month's time. From what I understand, we basically had the hospitals come up, and start, and it was bare minimum operations at the time. It was a couple beds, a couple, administrators, a couple medical professionals, and that was it. So we had a lot of challenges that we faced daily. The way in which we started to overcome them, I need to give a huge shout out to our administrative team and our administrative officers, because every day we had a meeting. It was a huddle of the heads of all the team members that were there. chief medical officer, chief of nursing supervisor, behavioral health, social work, occupational therapy, respiratory therapy, physical therapy, nursing. Everybody was seated at the table, and we had to have basically daily huddles of how we were going to do everything from our daily rounds to the operations of the hospital, the safety protocols that were in place, the infection protocol that was evolving every day, to when we were going to go in and see patients, how we were going to see patients, making sure that they had privacy, had access to showering, to food, at all times of the day. So it was very challenging initially, but I need to give a huge credit to our administrative team and our administrative officers for facilitating that environment, because they did such a great job at facilitating those discussions. And then over time, over the course of a couple of weeks, when we started getting more regular staffing there who knew how to work with one another. Again, there was a civilian and a military component, so you had those two types, of organizations not clashing, but coming together and trying to find a way to work together. So from that perspective, that's how we did it, daily huddles. From a physical therapist perspective, it was very different treating from what I was doing in more of an outpatient orthopedic sports injury type of setting to a more acute, subacute, inpatient type of treatment, treating what was at the time what we knew was more of a cardiovascular pulmonary type of disease or respiratory disease. So that was definitely a change for me as well. But we learned about all the systemic effects of the virus while we were there. So it actually turns out that, we're treating it now in the outpatient setting because of the, effects and the systemic effects that COVID-19 has on people. We're treating them post, COVID-19. Now you asked me how it made me a better therapist. Well, it definitely made me a better therapist and a better administrator. I also went to school for healthcare administration, so I do have a little bit of a background there as well. And in terms of how it made me, a better therapist and a better administrator, I think, again, seeing our leadership team and seeing how effective they were at facilitating discussion, leading discussion, and really, promoting the input of every, provider, every healthcare practitioner, every administrator that was there, I think was huge, because you really see how you can lead an effective team and how to lead a very, very big operation. And when you see that, it can't be understated, the facilitation of discussion that they had and that they had, during those huddles. It can't be understated. The communication was open from all providers. Every provider's input was greatly appreciated. And, one by one, everything, got worked out. So it was really important, I think, for me to see that, as a clinician and as somebody who, has, been in an administrative role before. It was really great to see.
Definitely. And just hearing your experience, just being there and having to essentially just like get up and like go work somewhere that you haven't, been before, and everything, and dealing with a virus that you've never encountered. None of us have ever encountered. I'm sure that this experience will remain with you for the rest of the duration of your life. But I'm really curious to know, so throughout the ordeal, how were the rights of the patients honored?
That's a great question. But before I actually answer that, I worked on the front line for a short period of time. There are thousands and thousands of providers that are working on the front lines every day still. So I had a small taste of it. And what I need to do is I need to give a huge thank you to them, because they continue to do it day after day. And they do it often, for very long hours, and they're treating this virus. So I need to give a huge thank you to them, because I only had a brief stint at being on the front lines and seeing all of this. And I need to thank the ones who are still on the front lines, fighting, for our patients every day. So how are the rights of the patients honored? So I talked to your last question. I said how much we had, effective communication throughout, those daily huddles. And part of what we did in those daily huddles was really to get a good, an effective communication line from when we knew that we were going to be accepting a patient until their discharge. So all the way from, who they were, where they were from, where they lived, what part of New Jersey they were from, all the way to their living situation, and their requirements and their needs, for when we discharge them. We had this streamlined communication where we knew who was going to be getting all the information, and made sure that we didn't have to overlap or have any breaks in the chain, to put it simply. We made sure the patients knew exactly what we knew about the virus, because again, late April, May, a lot of evolving characteristics of the virus coming out from, our CDC, other countries from their studies about the virus. So we made sure that we were informing them as soon as we knew, and made sure that it was one voice, one solid message, and not conflicting messages from conflicting reports and all those things. So I think that was really from the first, from a broad perspective, what we were able to do and how we were able to keep patients' rights honored. From a physical therapist perspective, we did a lot of the small things, and we typically do a lot of the small things because we spend a lot of time with our patients, so we get to know them quite well, from their family situations to their living situations to what they like to eat, what they like to do for hobbies. We're there with them several times a day, just like all the providers, and what we did as a PT team is we really made sure that, if it was, just going outside, if something that simple. I mean, some patients hadn't been outside of a hospital room for 50 to 60 days. And the only time they were outside of a hospital room and breathed fresh air was when they were transported to the hospital. So we did something as simple as make sure, hey, you guys can go outside. We can sit outside. We can sit in the sun. We can get some sunshine. We can get some vitamin D, and we can get some fresh air. And a lot of them needed it anyway because of the pulmonary effects of the virus. We did anything for making sure that they knew that, hey, you're getting up, you're showering, you're exercising, you're getting yourself ready. We got fresh clothes for you. We had a lot of people who were Spanish speaking. So what our leadership team did is said, hey, if we have a lot of people who are going to be Spanish speaking, let's get a lot of providers who can speak Spanish, in some capacity. So if there wasn't anybody who was there that, the provider couldn't speak Spanish, there was always somebody there who could speak, Spanish, more effectively to make sure that they knew if, whatever we needed to explain to them was effectively explained to them. We play games when appropriate, obviously, and when safe with them, in groups, because like I said, a lot of them maybe came from, we had some patients I know that came from certain areas of from a different country, years ago. So, we put them together and made sure that they could socialize. We did all those small things. And I think those things added up to really say, hey, we're here for you. We're here to make sure that what we know, and, we're not trying to hide anything. It's the middle of a pandemic. We're not trying to hide anything.
Yeah, and it sounds like even though like there were challenges that like you said that you faced during that time, you were still able to like make light of the situation sometimes, by going outside, which is so important when you're quarantining and
Yeah.
playing games because, being in quarantine can kind of be a little bit depressing after a while when you're in the house. But so my next question is, as a physical therapist practicing right now, are you seeing any difference in the attitudes and the compliances of patients than you saw before the pandemic began?
That's another really good question. You see quite a bit of difference, I think. At Ivy, our patients are, very courteous and understanding because, they come in and they see people of all walks of life from a functional perspective on the spectrum, right? People on maybe the lower functional end of the spectrum to all the way to high functioning, athletic population. And also medically, you can tell, if people, might have a lot more medically going on versus somebody who really doesn't have any medical comorbidities. So I think where we are now, they're very, very aware and very, very courteous because as soon as they walk in the door, they know, we're adhering strictly to protocols because we see patients along that spectrum. And we have to be very, very diligent because we have to watch out for our patients. So I think because we have instilled that from day one when they walk in the door, I think we obviously have a high level of compliance because we have to. We work in the medical field. But I think because we do that, I think we instill that in our patients too, and they understand that, and they want to make sure that they're not overstepping or doing something wrong so that they can't come in and be seen for physical therapy or that they're putting other people at risk. Because the last thing they want to do is hurt somebody else.
Yes, definitely. Definitely understand that wholeheartedly. So my final question for you, Dr. Stahl, is so how can rehab therapists truly honor patient rights and their dignity, especially in a therapy setting where often everyone can see everyone else receiving the therapy?
That's a tremendous question. Again, you got some really good questions today, I'll tell you. So I think it's one that we as medical providers have to place a top priority on day in and day out because, in regards to patient dignity, as a physical therapist, again, we're seeing people all along this functional and medical, spectrum of health. And oftentimes in PT, whether you're talking about, a performance athlete, a high level performance athlete to, an older individual who has many medical comorbidities to, the busy parent, you see people all along, these different spectrums of life. And oftentimes because they're coming in for physical therapy or because of the need for physical therapy, we're seeing them potentially losing a lot of their dignity because of the amount of pain that they're in or because of, the injury that they have and they're not able to do what they want to do. So I think, not to steal your guys' line, but, a lot of our job is to really empower them, help them bring that sense of dignity back into their life. And, at Ivy, we have, a bell. I'm sure you see plenty of, things on the news of people ringing the bell, when they get done with their treatment. But we have a bell, in our offices. And that's meant to celebrate anything. It could be anything from, you walk for the first time without your crutches, to I ran for the first time since I had surgery, to I lifted my arm over my head for the first time and it didn't hurt. We try to celebrate all of those gains and all of those strides. And it's our jobs as physical therapists to help our patients see those gains and those strides. And I think it also helps too when you see other patients who are ringing that bell and we're cheering them on, because that kind of motivates them too in a way. It says, hey, I want to get there. I want to ring that bell. And, we have people ring it, several times a week because of, all the strides that we make. So I think that's the first thing. And I think it also starts for us as physical therapists on day one, because when we meet patients for the initial examination and intervention, it seems simple, but we truly have to listen to them and understand them. Not only from, a diagnosis standpoint, getting a good physical therapy diagnosis, movement-based diagnosis, but to understand what their lives are so that we can formulate a plan for them moving forward. We need to know what their daily lives are like. We need to know what their sport demands of them. We need to take all these things into understanding and say, okay, if you're here right now, here's where we need to be. Okay, here's the in-between and here's how we get there. So I think that's where the conversation starts for physical therapists, to getting for our patients to understand that we're there for them and that we're here for you to try to get you back to what you need to do. So other ways that, we make sure that we, that patients' rights are honored. Oftentimes, because you have maybe a setting where you have multiple providers, with multiple patients in the rooms, there can be a lot of data and information that other patients can see, or medical data that other patients can see. So it starts, with the setup of our clinics to make sure that all the medical information is properly, stored away and away from, public eye. And even if it is in more of a public place, oftentimes, we've had patients who maybe can see other patients' charts or things like that. And we say, excuse me, I'm sorry, but you really can't be over here looking at this. This could potentially be a HIPAA violation. And when you say that out loud in the clinic and other patients hear that, they respond and they go, wow, okay, these guys are really, on top of their game. And, they don't want us to have any medical data potentially available for somebody to use. So, it's those small things again, it's the things that you really don't think of until you think about them. But, all those small things, I think, is a good way that, us as physical therapists maintain those rights of patients.
Right. And I think that it's incredibly important, going back to what you said earlier about developing that relationship with patients. I feel like that's so important, because I know that going to like a doctor's office and not having that relationship, it can just make it difficult to communicate. So I feel like that's really important, to be able to communicate with your doctors.
Yeah, I mean, it's huge. I mean, if you have to come in, 2 to 3 times a week, you want, and you're going to be in an environment, you want, the people who you're with, you want to like them, and you are going to want to be around them, because again, the more we engage with them, generally, the better off they're going to be. I have them, say, hey, look up, what is going on with you, look up, and talk to Dr. Google, about all those things, that we talked about in the initial examination and assessment, and come back to me with questions. Because like I said, the more we engage with them, typically the better off they are, and we want them to have a more active role in their healthcare.
Definitely. Yeah, definitely. That was that was good. Well, Dr. Stahl, that concludes the interview questions. If you have anything else you would like to say, or anything that you want to mention before we end it.
Again, a huge thank you to all the providers that I worked with at the field medical station in Atlantic City. All of our leadership team, you guys were absolutely incredible, and nothing could have been, nothing short of amazing is what I consider to be our team over there. I need to thank, Task Force 352, Silver Dragons, the Army Corps of Engineers, and the Air National Guard for helping with everything. And I need to finally thank all of our frontline healthcare workers right now who are still fighting this virus. Hopefully, that vaccine's coming soon. And I really hope that we can, start to put this behind us. But again, thank you to everybody who I worked with. It was a true honor to work with you guys.
Yeah, and thank you, Dr. Stahl, for coming on and speaking with me. I had a great time learning about physical therapy and coronavirus. I never thought that those two would go hand in hand, so I learned a
Yeah,
lot
I know. Thanks for
today.
having me, Demi.
You're welcome. Thank you so much.